This is a movement analysis of a burpee at the knee and hip joints. Begin in starting position, standing straight up with your feet on the ground, shoulder width apart, as shown here. Phase 1 is the squat preparation phase. You're going to start in the starting position and you're going to end squatted down, bending your knees about 45 degrees, your arms extended, hands on the ground, shoulder width apart, a flat back, hips hinged backwards, on your toes with feet flexed at the ankle. At the knee joint, there is flexion of the thigh. The movers here is gravity. Antagonist is eccentric contraction of the rectus femoris, vastus lateralis, medialis, and intermedius. At the hip, there's an anterior tilt of the pelvis. The mover here is also gravity. Antagonist is an eccentric contraction of gluteus maximus and posterior portion of the adductor magnus. Phase 2 is the plank phase. You'll begin this position the same way you ended phase 1. Squatted down, bending knees about 45 degrees, arms extended, hands on the ground, shoulder width apart, flat back, hips hinged backwards on your toes with flexed feet at the ankle. You're going to end this position with your arms extended, hands on the ground, and you're going to extend your legs by jumping out straight behind you. Maintain a flat back, a neutral spine, and neutral hips. At the knee joint, there's extension of the thigh. The movers here is a concentric contraction of the rectus femoris, vastus lateralis, medialis, and intermedius. The antagonist is the biceps femoris, semitendinosus, and semimembranosus, and they are both passively lengthening. At the hip joint, there's a posterior tilt of the pelvis. The movers here is the rectus abdominis and the external obliques, concentrically contracting. The antagonist here is the psoas major and iliacus and rectus femoris, and they are passively lengthening. Phase 3 is the second squat phase. Again, you're going to start this phase the way you ended phase 2. Arms extended, hands on the ground, legs extended out straight behind you, maintaining a flat back, neutral spine, and hips. The end of this phase, you're going to jump back into a squat position, keeping your upper body in the same position, and your legs flexed, knees bent about 45 degrees, a flat back, hips hinged backwards, on your toes with flexed feet at the ankle. At the knee joint, there's flexion of the thigh. The movers here is gravity. The antagonist is an eccentric contraction of the vastus lateralis, medialis, and intermedius. At the hip joint, there's an anterior tilt of the pelvis. The mover here is also gravity. The antagonist is an eccentric contraction of the gluteus maximus and posterior portion of the adductor magnus. Phase 4 of the burpee is the jumping phase. Again, you're going to start this phase the same way phase 3 ended, maintaining the same upper body position, legs flexed in a squat position, knees bent about 45 degrees, flat back, hips hinged backwards, on your toes with your feet flexed at the ankles. This position is going to be done by extending your legs at the knee and your foot at the ankle. Jump from the squat position. Extend your arms at the shoulder so you are in a straight line in the air. Posteriorly tilt the pelvis at the hip to a neutral position. At the knee joint, there's extension of the thigh. The mover here is a concentric contraction of the rectus femoris, vastus lateralis, medialis, and intermedius. The antagonist is the biceps femoris, semitendinosus, and semimembranosus. They should be passively lengthening. At the hip joint, there's a posterior tilt of the pelvis. The mover here is the rectus abdominis, and the external obliques are concentrically contracting. The antagonist at the hip joint is the psoas major, and iliacus and rectus femoris should be passively lengthening. The fifth and final phase of the burpee is the landing phase. Again, start this position how phase 4 ended. Legs extended at the knee and your foot extended at the ankle. Arms extended at the shoulders and you are in a straight line in the air. Pelvis posteriorly tilted at the hip in a neutral position. This phase is going to end by returning back onto the ground. There will be a slight flexion at the knee. Pelvis and trunk will be hinged forward slightly at the hips. At the knee joint, there will be flexion of the thigh. The movers here will be gravity. The antagonist is an eccentric contraction of vastus lateralis, medialis, and intermedius. At the hip joint, there's an anterior tilt of the pelvis. The mover here is also gravity. The antagonist would be an eccentric contraction of the gluteus maximus and posterior portion of adductor magnus.